When you suffer an injury to a bone or to a joint in your body, what signs and symptoms should you look for to decide should you go to a doctor, should you go to an emergency room or urgent care facility? I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This is a question I'm making as part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. And there is probably no question I get more than, do I need to go see a doctor? So I want to address it in a general sense, not about I might have a tibial plateau fracture. What do I look for? This is really more of an overarching list of a few things you might look for to decide if you need surgery. It's not perfectly cut and dry, but they're generally good rules of thumb. The first, obviously, would be a very noticeable or obvious deformity. Your forearm or your upper arm's bent, it's crooked, or it's out of place. Say the ball's out of the socket or the kneecap has popped out of place. Obvious deformity that you can see, that you can feel, that's sort of a no-brainer. If you have that, you're probably going to want to go at least to urgent care, more likely an emergency department, to get that put back into place, and then depending on what it is, treated surgically or hopefully not. Another one would be very significant pain and swelling. So much pain that it's really uncomfortable and it's not being taken care of by anything over the counter or by ice. Probably a significant injury, not always a fracture or dislocation, but something potentially worth making sure that there's not a fracture or dislocation or something else fairly urgent going on. Also, significant swelling would lead to be something, hey, maybe you should see an orthopedic surgeon for it. Again, this is not medical advice. These are just the things you might think about. Also, you can't use whatever part of the body it is that you injured. You can't put weight on it, say if it's your ankle or leg or knee. Maybe you can't use your arm without significant pain. Those would be also signs that, hey, urgent care, emergency room, or at the very least, go see your primary care doctor or go see an orthopedic surgeon. Those are the urgent ones. The last one I'm going to mention is something that is a little more subtle, maybe something that doesn't come up in the first few hours, but that is you can't do what you want to do as well as you want to do it. So this gets to, all right, it's been a few days, it's been a week, it's been 3, 4, 6 weeks, and I'm still struggling. Maybe you didn't have the obvious deformity. Maybe you didn't have the significant pain or swelling. Maybe you were able to put weight on it without too much difficulty, or you could use your arm, but you just can't run. You just can't lift weights because of pain. You can't throw like you want to be able to. Whatever it is, if you can't do what you want to do as well as you want to do it, and when that is, again, anywhere from a few days to weeks or months, everybody's a little different about when they decide, all right, it's time to go see somebody. But if you can't do what you want to do as well as you want to do it, good reason to go see an orthopedic surgeon, especially one specializing in sports medicine, if sports or exercise is what you want to get back to. Now, if you have an orthopedic injury and you want to hear about more options other than surgery and other than cortisone shots, click the link in the description under this video. You can fill out the contact form to inquire about scheduling an appointment to potentially see me as a patient. And I'd love to hear your experience with your injury, whatever it is. Leave those in the comments below. Just understand, if you leave a question in those comments, I can't respond and give you medical advice. But like I did here, I might answer your question in a future video. Make sure to subscribe to my video channel, click the bell to be notified when I release a new video and when I start my next live stream, like my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.